Welcome back, everyone, to Psych Crunch. If you're new here, I'm Lara.
And I'm Tulika.
We're both IB psychology students, now in our second year, who are here to teach you about psychological phenomena which affect us in our day-to-day lives.
Today we're going to be focusing on a mood disorder which has a lot of stigma around it. This disorder is called major depressive disorder, or also known as MDD, or depression for short.
I'm sure that you guys have heard of depression before. You've either seen it in the media, like TV, or you know someone who has it, or you may have even experienced it yourselves.
Yeah, and especially knowing the demographic of our listeners, who mainly consist of people ages 18 to 30, you might be wondering how this is relevant. Well, research has actually shown that you guys have the highest prevalence rate of depressions around 18 to 25-year-olds, according to a study conducted by Twinge. So it wouldn't be a surprise if some of you actually experienced MDD for yourself.
Exactly, but I still think that we should define what depression is just to get the idea right. Because with so many outlets and such, I've noticed that people sometimes have differing ideas or opinions. So just to not create any conflict or disagreement, we'll define what depression is for you.
Yeah, I think that's a really good idea. So, major depressive disorder or depression is categorized as a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how a person feels, thinks, and behaves, and can lead to a variety of emotional and even physical problems.
Someone with depression may have trouble doing normal day-to-day activities and sometimes may feel as if their life isn't really worth living. Some symptoms also include loss of interest or pleasure, change in weight or appetite, insomnia or even hypersomnia, impaired concentration, and the most commonly seen in media, thoughts of death and or suicide.
Oh, yeah, that's one thing I've definitely noticed in media, and it kind of tends to show the extremes of certain disorders.
Yeah, I've seen that so much, but I think that's done in an effort to really communicate to the audience that a character is suffering from a mental disorder because really mental illnesses are silent killers. You can't physically see them like um physical
Yeah.
diseases, you know?
Yeah, that's very true, especially with depression. Sometimes you don't see that a person is suffering until it gets very bad. And I think there are still many people who are scared of the stigma that comes with it. And as a result, they don't really speak out. And this may have a lot of negative consequences. And
Mhm.
they might not even be aware that they're suffering from depression.
Yeah, I agree. I mean, that's why we're here, to make sure you guys are informed about different disorders and also where you can find support. Now, I'll be introducing the topic which we'll be discussing today, but I think it's also necessary to include a warning. We're going to be talking about different treatments available for depression. Now, most of what we'll discuss today is new research that we just found interesting, some of which you may think that you can do yourself if you've been diagnosed with depression or even suspect that you have depression. But please do not try to replicate the treatment methods we'll be discussing today unless a healthcare professional or a psychologist that you're seeing recommends it. Again, we're just students sharing our findings. If you really believe that you're suffering from depression and want to reach out, contact the local healthcare officials in your area and seek guidance. We also have emergency mental health aid numbers you can call on our website's front page.
Yeah, and guys, please, mental health and depression are really not to be taken lightly, and we strongly encourage you to seek help. It's always better to start earlier because before it gets worse. And now that we have given a fair warning, I think we can begin looking at our findings today. We tasked ourselves to find a biological, cognitive, and an alternative method for depression.
Some of what we found was so eye-opening, and I think you guys will really find it interesting too. I myself think that we should start with the biological treatment because I just can't wait to share it with you guys.
Okay. Let's go ahead, shall we?
Okay, so the biological treatment we'll be discussing today is not medication or SSRIs, which I think are the most popularly recognized biological treatment, but instead we'll be looking at psychedelics.
Oh, wow. Don't they make you trippy and see squiggles everywhere or something? How's that going to treat depression?
I mean, that's what everybody thinks, and it's a common misconception that I'll admit that it was just like that too before I looked into the research, but I'll address your questions and any concerns you may have later. So the specific psychedelic relevant to the treatment of depression, at least for this study, is psilocybin. It's a serotonin receptor agonist that occurs naturally in some mushroom species, and recent studies have assessed the therapeutic potential of this psychedelic for various conditions, including end-of-life anxiety, OCD, smoking and alcohol dependence, and this preliminary research has shown promising results. So one researcher, Carhart Harris, and his researchers' friends aim to investigate the feasibility, safety, and efficacy of psilocybin in patients with unipolar treatment-resistant depression in 2016.
Yeah, so in this open label feasibility trial, 12 patients, in which 6 were men and 6 were women, with moderate to severe unipolar treatment resistant MDD, received 2 oral doses of this psychedelic in the concentrations of 10 milligrams, 20 milligrams, and 20 milligrams. And they were given this psychedelic 7 days apart in a very supportive setting. There was no control group, and this psychological support was provided before, during, and after each session. The primary outcome measure for feasibility was patient-reported intensity of psychedelic effects. Patients were monitored for adverse reactions during the dosing sessions and subsequent clinic and remote follow-up. And so what was seen was that depressive symptoms were assessed with standard assessments from 1 week to 3 months after treatment, with a 16-item quick inventory of depressive symptoms, serving as the primary efficacy outcome.
And the quick inventory of depressive symptoms is basically just a self-assessing questionnaire survey to rate symptoms of depression. So what these researchers actually found was that the psilocybin's acute psychedelic effects typically became detectable 30 to 60 minutes after dosing and peaked 2 to 3 hours after dosing, and then subsided at least 6 hours after dosing. The mean self-rated intensity on a 0 to 1 scale was 0.51 for the low dose session and 0.75 for the high dose session. Psilocybin was well tolerated by all patients, surprisingly, and no serious or unexpected adverse events occurred. The adverse reactions they did note were some anxiety during when the drug was first administered, and this was seen with all the patients. There was also transient confusion or thought disorder in 9 patients. There was also mild and transient nausea for 4 patients and a transient headache for another 4 patients. Relative to the baseline, the depressive symptoms were marked on the questionnaire as reduced for a minimum of 1 week to up to 3 months after the high dose treatment. Yeah, and they also marked that they had reduced anxiety, which was also really insane and surprising.
Yeah, that is definitely very surprising. I definitely did not expect that.
Honestly, I didn't either. I never would have even thought about psychedelics possibly helping treat depression. Although the study was preliminary, the researchers did recommend that more research and studies should be conducted before it's provided as a form of therapy.
Yeah, I mean, I think I do see some limitations to the study for sure. And like you said before, no control group was present. And I really think that there could have been a placebo effect. Sample might have simply been tricked, might have simply tricked their mind into believing that an effect was taking place or present, even though there wasn't one taking into effect.
Yeah, I do see your point with the placebo. I mean, after all, they were literally administered something, so like placebo medicine, I guess. I also did note that there was like no prior test conducted to understand the state of the patient's depression, or at least one that we were informed of that we could analyze right now. And as for this being used as a treatment, my main concern is really that hallucinogens have a lot of social stigma associated with them. So I mean, they're associated with hippies and maybe even criminals. It's just a negative image overall. And I'm afraid that this could potentially also add more social stigma to the already existing negative image of
Yeah,
depression.
that won't be too helpful, would it? But
Yeah.
yeah, that definitely could happen too. I mean, overlooking the limitations, the study wasn't too bad, I think. There was sufficient amount of correlation that was found between this psilocybin, the hallucinogen, and reduced symptoms of depression. And the sample actually included both men and women, so I think it was pretty representative. And it was an open label trial, which means that the participants were aware of what was being administered to them. So, in a sense, it was very ethical, right?
Yeah, of course. Like the researchers have stated though, I think more research should be done because at the moment there really isn't enough. I was only able to find maybe 3 to 5 studies relating to this, and the evidence does show support in most of them. But I'm going to guess that trying to get permission to do something like this involving psychedelics and people with mental disorders can be hard.
Yeah, I can't even imagine how hard it would have been to try to convince someone that the study was ethically approached, especially nowadays, because everything has ethical consequences.
Exactly. Honestly, I think that once you see the evidence, you believe it. But otherwise, this sounded completely insane to me. Anyways, I think that we should move on to our next treatment method now before we get too wrapped up in this.
Yeah, I think we better should. I think we should do the alternative treatment next. What did you have in mind?
Okay, so for the alternative treatment, this is one that's very surprising, and our younger users may actually really like the findings of this. Even though, well, there is a turn, you'll see later on. But an alternative treatment for depression is actually video games. I know,
Oh,
surprising.
wow.
Yeah. So
And we
here
actually covered video games in our last podcast, so make sure to check that out because video games can have a lot of impact on our behavior. So go make sure to
exactly.
check that out as well.
Yeah, I think video games get a really bad rep. But like we said in our previous podcast, they can be helpful. Anyways, getting back to this, so existing treatments for depression are known to have only modest effects and are insufficiently targeted and are inconsistently utilized, particularly in older adults. So, yes, this treatment of depression is for older adults at the moment. So, older adults with impaired cognitive control networks tend to demonstrate poor response to a majority of the existing depression interventions. Cognitive control interventions delivered using entertainment software, on the contrary, have the potential to not only target the underlying cerebral dysfunctions associated with depression, but to do so in a manner that is engaging and engenders adherence to the treatment protocol. So,
I see.
this study, which was conducted by Anguera eh, and others in 2013, decided to carry out an experiment on this. So they did a proof of concept trial where they took individuals with late life depression. Um, the sample consisted of 22 people with late life depression who were all above this age of 60. And the sample was randomized to either problem solving therapy, so 10 were put in that, or a neurobiologically inspired digital platform designed to enhance cognitive control faculties. And the video game was called Evo, and for this they put in 12 participants. So, given the overlapping functional neuroanatomy of mood disturbances and executive dysfunction, they explored the impact of an intervention targeting cognitive control abilities. So, like video gaming does. Also, functional disability and mood in older adults suffering from late life depression, and how these outcomes compare to the therapeutic standard which already exists.
Yeah, I mean, I'm pretty sure you guys are very interested to know the results. So let me talk a
Yeah.
bit about that. Yeah. So the participants that did the gaming, so the Evo, they actually demonstrated similar improvements in mood and self-reported function after 4 weeks of treatment compared to the problem-solving therapy participants. So the video gaming participants also showed generalization to the untrained measures of working memory and attention, as well as negativity bias, a finding not evident in the problem-solving therapy condition. And in addition, individuals assigned to the video gaming actually demonstrated 100% adherence to the treatment. So this was
Wow.
definitely a very big finding, yeah. And the conclusions of the study was essentially that it provided preliminary findings that this therapeutic video game targeting cognitive control deficits may be a very good intervention. And I think that there still needs to be future research is needed to confirm these findings.
Mhm. Like with what we discussed before, with the psychedelics, again, it's very new research and more research should be conducted.
Yeah, but looking at the study in a whole and the whole concept, there are definitely a lot of strengths.
Yeah,
Firstly,
yeah.
it established a correlation between video games and improvement of depression. So one could easily see the connection between video games and the improvement of depression.
Mhm.
And I think one of the major strengths of this treatment as a whole is that video games are very accessible to everyone. I'm pretty sure some of you guys, or most of you guys, if not all, are exposed to some kind of games, whether it's on your phone or like actual video games like PS4 or Xbox, right?
I know I am. So,
Yeah, and it's a lot easier than medication because for medication you might need to go to therapy or you might need to get a prescription, but this is very accessible to everyone. That's definitely one of the strengths of the treatment. And
Mhm.
another one, a quite obvious one, is that they might have less stigma than medication. So that's definitely something a person might want to take into account because, like the things we discussed before with the psychedelics, there was this layer of stigma which could have deterred a person from choosing that treatment. And video games offer a very open community where people can can game, and this could improve their symptoms of depression for sure.
Yeah, I agree completely. It is much more accessible and I think acceptable to video game than to do psychedelics in our society. Maybe in the future, I don't know. But like any study, this study I also did notice had some limitations or some things that weren't really perfect, top
Yeah,
notch. So obviously it was only for older individuals who had late life depression. And as we discussed before, the prevalence rate, it's higher for our age group. So of obviously older individuals do need help themselves, but for general depression, it's not too applicable. There's also a very small sample, and again, it's reflective of a small part of the population, the older populations who have late life depression. And another concern that I have had was that the patients self-reported their improvements after the 4 weeks.
that's a big one.
Mhm.
Yeah,
Yeah, and this could be a form of bias. It could be that they just wanted to please the researchers with that show that they improved. I don't know,
yeah,
but self-reporting solely isn't always the best way to get results. Um, so the bias, this in this case, would be the bias of demand characteristics. They may have acted the way that the researchers really expected them to act. Another concern that I have, even though even in our last podcast we talked about the benefits of video gaming isn't always the best. Spending a lot of time in front of the screen can have
yeah,
other psychological effects that may not be favorable. So I know that I've read some stuff about how if you play a lot of violent video games, then you would develop emotional desensitivity to violence. So that's actually what I did my EE on. But I really think that, I mean, I'm not too familiar with what Evo is, so it may be completely fine. But if people just take on video games to treat depression and they look at violent video gaming, that could be an issue. Um, Another thing, the time that you should play the video game was not really specified.
Yeah.
So we don't really know how long these older individuals played video games in 24 hours. Maybe they played six
Yeah.
hours, hours. It's not
Yeah.
really defined.
Yeah, and I think also another limitation is that the video game and the connection with depression itself, it's not really clear on exactly how it leads to alleviating symptoms of depression,
Mhm.
right? Just playing video games,
Yeah,
but
exactly.
how does it lead to the treatment of depression? That's a bit unclear from the study itself, I think.
Yeah, and since that wasn't really like they couldn't really identify a direct correlation or like at least talk about it, I think that maybe the findings could even be again demand characteristics or short term because
Yeah.
I see how it could work, but I don't know. It's new research. More research should be done again with this as well.
Yeah. Well, luckily, our next one has a lot of research done to it. Um,
Perfect.
so in that case, shall we move on?
Yeah, I'm fine with that.
All right. So let's do the
So,
cognitive treatment next.
okay.
And yeah, and in the cognitive treatment, one of the probably the most common and popular one is CBT. Have you heard of it?
I have. I think I have. It sounds familiar.
Yeah, so it's a very popular treatment that many therapists use right now. And and it kind of helps you identify troubling situations in life and really become aware of your thoughts. Um,
Mhm.
so let me give you a brief introduction to it. So,
Okay.
cognitive behavioral therapy is one of the most evidence based psychological interventions for treatment of several psychiatric disorders, such as depression. In fact, there has been numerous studies that showcase the efficacy of CBT or cognitive behavioral therapy in depressive disorders, especially when combined with pharmacotherapy.
Oh, I see. I'm guessing pharmacotherapy is the treatment of a disorder or disease with medication.
Yep, you are absolutely correct. So, evidence also suggests that the relapse rate of a patient treated with CBT is a lot lower in comparison to patients treated with pharmacotherapy alone. And like you said, cognitive theory conceptualizes that people are not influenced by the events, but rather it's their cognitive viewpoint on events that occur to them.
Okay, that makes sense.
Yeah, so it essentially means that individual differences in the maladaptive thinking process and negative appraisal of life events lead to the development of dysfunctional cognitive reactions. And this cognitive dysfunction is in turn responsible for the rest of the symptoms in affective and behavioral domains.
You know what this reminds me of a bit? It's like I see how it can align with Beck's cognitive theory. Like
Yeah,
I remember studying that in a lot of depth. He argued that depression is rooted in what's called a patient's quote automatic thoughts. That is negative self schemas organized around themes of failure, inadequacy, loss, and worthlessness, which are triggered by negative events. So these are dysfunctional beliefs, right? And all these personalized thoughts are triggered by particular stimuli that lead to emotional responses. The negative cognitive triad, I'm not sure how to pronounce that word too well, but as Beck states, this phenomenon is as follows. Depressed patients have negative views about their self, the world, and the future.
yeah, you're actually very right. In fact, Beck was known as the father of CBT, and he was, in fact, a very important figure in the development of CBT. In fact, they also conducted a study to see if it was effective, but the study is very old, dating back to almost the early 1900s.
Oh, wow. That's actually really interesting. And it's so ahead of its time. We still use it today.
Yeah, for sure. What I wanted to do is kind of to look at more recent studies. Is that okay with you?
Of course, go right ahead.
Okay, so one piece of supporting research done by a researcher known as Serfate et al. It's about the clinical effectiveness of individual cognitive behavioral therapy for depressive older people in primary care. So, in older patients, depressive symptoms are common, they need psychological adjustment to aging.
Mhm.
Complex, right?
Yeah.
And it's associated with chronic physical illness, limits the use of antidepressants. So these group of people, they're not really being, they're not benefiting from antidepressants. Despite this, the older people are rarely offered psychological interventions, and only 3 randomized controlled trials of the CBT in primary care setting have actually been published.
Okay. Um, I get it, but so the aim of the study was to determine the clinical effectiveness of CBT delivered in primary care for older people with depression. Okay, right? Am I right?
Yeah, that is right.
Okay. So what was the research method for the study then?
So it was a single blind, randomized controlled trial with 4 to 10 month follow up visits. The procedure included a total of 204 people aged 65 years old, and they had a geriatric mental state of diagnosis. So, this is kind of a diagnosis that is done on the older generation to determine whether they're depressed or not.
Mhm.
And the interventions included that they would be offered treatment as usual, so the treatment that they would usually take, plus a control treatment, so forming the control group, or they would be offered CBT. So it would be the treatment that they would usually take alongside either the control or with CBT. And these were offered for over 4 months. And in addition, the Beck Depression Inventory, so this again questionnaire slash test scores the participants on a baseline. They collected baseline data, and
Mhm.
at the start and at the end of therapy, so in about 4 months and 10 months after the baseline visit. And they also conducted a bunch of other questionnaires and measures, such as the Beck's Anxiety Inventory, Social Functioning Questionnaire, and something called the Eurocall.
Okay.
Essentially, what the results showed that the CBT is a very effective treatment for older people with depressive disorder and appears to be associated with its specific effects.
Wow. I mean, I didn't even think about that because um we just looked at the study done on older people as well with late life depression. So honestly, I'm really surprised that a lot of people are looking into depression in older people,
Yeah.
even though that is the prevalence rate. I changed what I said before. I think that they should be considered as well. Um, because I always overlooked that older people can also suffer from depression since we usually see it with our age group, you know?
Yeah.
Especially during the pandemic when they're told to isolate and quarantine more than any other generation because they're so high risk. So I'm actually really shocked. In fact, it has been suggested that depression in old age may be a consequence of social and emotional isolation, and that simply spending time with the patient may be a benefit. But now, because of the pandemic, that's even harder. And
Exactly.
on like Zoom sessions are great, but they're not the same as meeting in real life.
Yeah, for sure. And I think we all experience that with online schooling and
Yeah.
everything. Yeah. And yeah, that's right. And that's actually a very good thing and a positive side of CBT is that it's modifiable to anybody's needs. In fact, one of the strengths of the study is that CBT techniques were modified for the use in older people, with the increased structure of sessions in the technique to facilitate recall, because that's a struggle with older people. And where relevant, specific issues associated with old age were addressed, with exploration of patients' beliefs about the negative impacts of physical health, and their perceptions of themselves in the context of their age. And so they
Mhm.
helped them with the coping of their age and etc. So it was very specific to this demographic.
Yeah, those are actually some really good points. I think that another strength could be the fact that they used randomized controlled trials. So it made it that one treatment is directly compared to another to establish superiority more easily. In this case, it was the medication versus the cognitive behavioral therapy. And I also think that the study's design can make casual inferences. So it is the strongest empirical evidence of a treatment's efficacy.
Yeah, and with randomized controlled trials, you can also limit and minimize bias. So randomization minimizes allocation bias and selection bias, and blinding minimizes performance bias. And so
Mhm.
all of this kind of the methodology minimizes the biases that are commonly associated with and perhaps even lead to non-valid results. So I think this was definitely a very good strength because it kind of took care of all the biases by making it blind. And in addition, randomization minimizes confounding variables due to the unequal distribution of prognostic factors and makes the groups even more comparable according to both known and unknown factors. And I guess some other strengths include that it uses a standardized questionnaires, like I mentioned before,
Yeah.
and this, right?
Mhm.
And this makes it so that each individual can be effectively compared either to themselves or to uh, other people in their group or in the other condition. And again, this eliminates researcher bias. Use of baseline scores at the start and also meant that each individual could be compared to themselves to see how they progressed and to essentially determine whether CBT improved or worsened their depressive symptoms.
Yeah, I agree with all the points that you're making. It does have, you know, a lot of strengths in the study and a lot that really strengthens the reliability of the data, you know. In addition, the like I think that the study had a relatively small sample size, which was biased for the older population. So, like I keep on saying over and over again, you can't really extend these findings to other demographics, as there may be other factors that affect, let's say, younger generations than the older generations. Um, After all, different generations deal with various problems in a different way. They approach it differently. And perhaps not all of them can be treated with CBT. For example, if you guys remember from our last podcast, where we talked about the impact of technology on youth, we can bring this problem up again. Technology is a huge problem for our generation and for the youth today, and it may not be as big of a problem for the older generation, even though the study we just talked about like before was about video gaming and older generations. But like looking at it separately, older generations use less technology than us.
Yeah, that is very valid. I think I think now we obviously, like you have said also many times before, we need to look at more studies
Mhm.
to determine this for sure, and especially in different demographics. Yeah, so
Yeah,
let's to some of the strengths now. Strengths and weaknesses of the actual therapy itself.
yeah.
I think are some of the strengths.
So I think the chief strength of CBT lies in the fact that it not only helps the individual to overcome the symptoms of the issues currently being experienced, but also help equip them with new skills and strategies which can be used like for future difficulties or any future issues that may arise, you know?
Oh yeah, kind of like this saying that goes like, "Teach a man to fish, and he'll never be
Oh
hungry for life."
yeah, teach a man to fish and he'll never go hungry. Exactly, like that.
Yeah, that is a very good point. I think another
Saying for
strength.
this.
Sorry.
I think it's a great saying for CBT.
Yeah, for sure. Uh, and I think another strength could be that CBT is evidence based. So, like we saw from the other two, perhaps there was a lack of evidence or there weren't a lot of studies conducted. But with CBT, that's actually not such a big problem. It has been proven to be effective for the treatment of depression and anxiety-related issues in multiple studies. And in addition, it's actually being used right now, and it's a very common practice. And another thing is that it's very cost effective. It tends to result in a change occurring quickly when used in some types of problems. And another thing is that CBT focuses on an individual's thoughts and addresses the root of the problem. And this could really help in the treatment and perhaps even in the long-term treatment of depression, which
Yeah,
obviously.
definitely. I agree. And I think it's important to note that, like, from what we're discussing today, CBT is the one that's really actually implemented in the treatment methods. The other ones are just trials, but CBT really does have a lot of evidence behind it.
Yeah, for sure. However, I think I can still come up with limitations. As psychologists and as
Yeah,
students,
of course.
we need to think of limitations because I think they're very important. But yeah, so CBT, I think one of the limitations is that it's classified as a very directive therapy that aims to change the thoughts and beliefs. But I think sometimes if the psychologist does it or the therapist does it in a very forceful way, it could lead to a lot of ethical considerations. And this method might even be considered unethical.
Yeah, like I don't usually relate this to psychology, but it is a bit like indoctrination. And I know indoctrination has a negative connotation to it, but it is that, you repeat it to someone until they really believe it. And if it's forceful, it may have negative effects. So this could potentially harm the individual psychologically in a way. But again, making we're just assuming. We don't really see the evidence for this as of yet.
Yeah, I think that is definitely an ethical considerations that a lot of a lot of psychologists do consider. In fact, there's a common saying is that doctors cannot actually force a patient; they can only advise. So I think keeping that in mind, CBT can be very effective.
Yeah, definitely. I also think that sometimes the cognitive model or theories are very, very narrow in scope. So our thoughts are just one part of being human. There are more issues that need to be addressed. For example, biological disorders, you know?
Yeah, for sure.
And
Uh,
lastly, yeah.
yeah, go ahead.
Sorry. Lastly, I also wanted to share something very insightful with our listeners today. So recently, our psych class started journaling, and I found it to be very helpful actually in processing my thoughts and emotions. I found the ABC method particularly to be very helpful.
Like A, B, C, D, like the
No,
alphabet, or
no. It's like an acronym, okay? So it's A, the activating event, for example, the event that caused the meltdown or the panic attack. B, the individual's belief relating to the event and the consequence this belief has on their life and their relationships. And finally, C, these are the way to change the individual's belief about this event that occurred. For example, changing the belief in the event and the consequences caused by this belief will also change. Does that make sense?
yeah, that makes sense. And I'm guessing you're trying to say that by writing about it, it makes you more, it makes you kind of gather your emotions more and kind of
Mhm.
replicate CBT in a more personal manner that you could kind of do every day, right?
Exactly. Putting that in the terms of CBT, I think that's exactly what we're doing.
Yeah, that's very interesting for sure. Thank you so much for sharing. And the time has come. We have to end this podcast. And I really hope you guys found this helpful and hope you learned something.
Yeah, that's it for today. We hope that you guys enjoyed this podcast. I know it was a little longer than usual.
Yeah, and make sure to join in next time. Bye.
Bye, guys.